I just wanted to share a personal reflection. I was reading this book called Simple Rules: How to Succeed in a Complex World. And it gives many examples of how complex organizations with lots of complex rules further advance their cause by simplifying everything. And it drew my attention to annual health checks. Annual health checks are something that are carried out in primary care for people with learning disabilities and autism. It costs the NHS approximately £46 million a year based on those who are registered with a learning disability and autism. And it's supposed to be a comprehensive health check in primary care. Unfortunately, the data shows that there isn't really a transferable benefit afterwards because of the complexity of it. And I was thinking, why don't we transfer that same experience into annual health checks by simplifying the assessment? What if we were to just simplify it down to 5 things that we need to support that individual on? That could be weight monitoring, that could be blood pressure check, could be a cancer screening, and then deliver those 5 objectives with the highest quality. Because right now what's happening in primary care is that the annual health checks are extremely complex. Every single area needs to be covered. And then what happens? Primary care leaves them till the end, just before the end of the tax year, so they can claim their expenses. However, the individual isn't really getting the right quality of care. So what I suggest, this is my personal suggestion, is that we really need to look at simplification. Another area we can talk about is hospital passports, of how we've made them more complicated. But in this regard, it's the annual health checks. If we can simplify the check and focus on 4 or 5 core areas, I believe we can make a bigger impact on that individual's life than covering everything in a short space of time.